Welcome to this medicine masterclass on muscular dystrophies. We are going to cover Duchenne's, Becker's, Facioscapulohumeral muscular dystrophy, also known as Landausi-Dejerine syndrome. Duchenne's muscular dystrophy has an early age of onset, usually 4 years old, and presents with severe muscular disease. Gower sign is present where the patient uses their hands and arms to stand from a squatting position due to weakness of the other muscles. And this occurs due to absent or non-functional dystrophin and is associated with decreased intelligence. As a result of poor muscle action, there is early respiratory failure and pseudohypertrophy of the calves. Becker's muscular dystrophy, age of onset is slightly later in the teens. The symptoms are milder than those of Duchenne's, and that's because rather than absent or non-functional dystrophin, patients have partially functioning dystrophin and intelligence is not impaired. Patients can often ambulate beyond the age of 15. The mutation is the same as in Duchenne's muscular dystrophy. That's in the X chromosome, position 21, and the diagnosis is made on Western blotting, and the samples will show abnormal or reduced dystrophin rather than absent dystrophin. Facioscapulohumeral dystrophy, also known as Landausi-Dejerine syndrome, is where the fascio or the facial muscles are affected. The patient is unable to puff out their cheeks. Scapular, there is winging of the scapulae. Humeral, they have difficulty raising their arms. These findings are associated with Landausi-Dejerine syndrome. The patient will have weak facial arm shoulder muscles and may have foot drop too. In this condition, on examination, the patient will have ptosis, difficulty closing their eyes, expressionless face, and inability to effectively articulate speech due to the facial involvement. They will have a wasted sternocleidomastoid and neck muscles and winging of the scapulae. The lower pectoral muscles will also appear wasted, and they're likely to have hypertrophy of the deltoids to try and compensate for the other muscles, and usually have absent bicep and tricep jerks. Beaver sign may be positive. This is where the lower abdominal muscles are stronger than the upper abdominal muscles, so when the patient flexes their neck in a supine position, there's a marked upward movement of the umbilicus. So in summary, we've distinguished the key features of Duchenne's, Becker's, and Landausi-Dejerine syndrome. Thank you for attending this medicine masterclass.